further ado, please join me in welcoming our CEO and co-founder, Derek Chu.
Thanks a lot, Cass. All right, it's a good morning to see everyone here. Thank you all so much for coming down to Mental Health Festival 2023. I am super excited for a variety of reasons. Firstly, I think it's the first time I'm seeing all of our different industry stakeholders, partners from all across Singapore, even beyond, coming together to one room here. So it's really, really exciting. As the slide here says, this is our biggest and best mental health festival yet. This is actually, for those that aren't aware, Mental Health Festival is an annual affair that we run every single year, around this time of year during Mental Health Month, where you really want to drive awareness and change, right? And for the first time ever, this is the first time we're doing it in person. So it's really great to see everyone face to face. And I saw many friendly faces earlier, so thanks so much for that. When we started Mental Health Festival, we had two key objectives that I just want to kick off in this opening keynote here. The first key thing that we wanted to do is actually driving awareness, education, and literacy across the topic of mental health that, a few years back was still a bit more stigmatized. We wanted to change how actually people see and view this topic. The next thing we want to do actually was around driving action and change, which brings us to our theme in a second. We believe that once people have awareness and are understanding what mental health actually is about, how it relates to them, what's next is actually critical. All right, so let me just move on. So I believe a good amount of folks in the room would know who we are, but for those that are new to us, welcome. It's a pleasure to speak with you here. A little bit about who we are here. Intellect, we are the region's leading mental health care and benefits company. We believe in providing end-to-end care for anyone from any walk of life in any part of Asia Pacific, and today beyond as well. Today we have the pleasure of serving over 3 million lives and some of the leading and largest employers, government agencies, healthcare systems, and more. And I'm really, really glad to share about what we're up to next as well. Okay, so what I'll cover next, actually, just briefly, it's two key things. Right, I want to start with the situation at hand, the context of where we believe mental health is today, and what it means for society, for all of us in the coming years to come, right? I'll also touch on some of the trends that we see happening across the region, across Singapore and the world. And last but not least, I'll touch upon what we're up to next that we believe will drive change and improvement towards the mental health care system here. All right, so first and foremost, this isn't news to the room here. For the longest of time before, mental health is a big topic here for all of, I think, history and a lot of the 20th century. Physical and medical health was the key focus for many of us in healthcare systems, in insurers, for governments, for individuals itself, right? And that remains true today. However, we're seeing a huge change happening. We believe that behavioral and mental health is the defining problem of our century. And we're seeing this happen already a lot of times, all right? Just looking at some of the stats here, you can see that, this actually came from one of the Singapore studies not too long ago. 1 in 7 people actually experience a mental health disorder in their lifetime. I actually just read this updated stat that came up, I think, in Singapore yesterday. This number has gone up. It's now 1 in 5, but I think about 18% or 20% of people that actually have mental health issues. And that's a really alarming number. But that isn't news to this room here, right? But we see other stats like this. Unfortunately, we see some of the highest suicide rates post-pandemic. Many of us, people ask me, do you think that the mental health awareness, the buzz is going to die down after the pandemic? The reality is no, right? This is a catalyst and a change where we see, in a good way, more things happening, more people pushing the movement forward, but we also see the issues, the distress actually growing more and more every year. We see also in the workplace, in our daily lives, increased anxiety, depression rates, leading to loss of productivity, costs for employers. And according to individuals in workplaces where some of us here really do care about, for some reason as well, a lot of employees actually feel that the benefits around mental health is not sufficient today. So we're looking to tackle all of these things and more. So that's exactly what Intellect aims to solve, right? When we started Intellect, we had a couple of key things we wanted to solve for, and I could boil it down to maybe 3 key things, right? Firstly, access, affordability, and actually speed to care as well. So 4 key things that we aim to solve for Intellect. First and foremost, it's access to masses. We believe that more people should have access to care in a very easy, meaningful way that's actually very, very accessible. The second thing is cost. So we believe that mental health care is very important, but one of the big barriers naturally is cost. So how can we actually lower costs for our employers, our clients, our partners out there? And the third key thing is that we want to make mental health relevant and accessible through making it relatable as well. All right, so a lot of the programs we build at Intellect is on making and breaking down the stigma behind mental health issues, mental health disorders that many may shy away from, by making it relatable to our everyday needs as well. So we cover across the spectrum. And last but not least, we believe in making evidence-based and clinically backed solutions and programs for all that we do here. So, our clinical team drives a lot of work behind publishing papers, and we have a lot more ongoing as well. All right, so very, very quickly, the progress we've made, and I'll just give a very quick one. Intellect's been around for now the fourth year of being around business, and a lot of things has happened. From a team of 2 people, now we're about 150 plus strong, employees, and hundreds more of clinical providers across the region. And we've seen a lot of change of progress happening over the last few years, from the launch of our Mental Health Festival in 2021. We launched and scaled across Asia in 2022 and beyond. And this year, we have expanded our suite of services to go beyond just mental health care, to also support everyday holistic well-being needs and more as well. So a lot of stuff that we've been up to and quite busy with. And this is a quick glimpse as to what we also strive for. One of the key facets of Intellect's, I would say our modes and what we believe in, is driving accessibility through localization. So we now have people on the ground in over 10 countries. This is just employees. And our network of clinicians is actually in more than 20 countries today across the region, so that anyone who needs care gets localized support. All right, so I'll move on to the last segment as to what the trends are. All right, so we see 3 key things happening, or rather, we want to scope in and focus on 3 key areas that we think are important today and what's happening next. The first one is that we're seeing an evolution of mental health support growing from a sole individual's responsibility, us caring for ourselves and looking out for ourselves, to now being a collective shared one. This means that people in the ecosystem, employers, insurers, the government, has a part to play, and we're seeing that happening. The second key trend that we're seeing is that mental health and measuring for success has always been a struggle for many of us, right? Be it insurers, be it government. Given that it's not as black and white, it's not like a blood test, it's always hard to, in some cases, justify what is the ROI in mental health. And that's what we've been working on for the last year plus as well. How can we actually drive ROI and showcase outcomes beyond just take-up rate, through showing value-based outcomes as well? And the last thing is that mental health benefits, this is naturally a very clear and key need. It's not just for folks who can access it, not people who are in companies that have benefits, but really for anyone who needs it. So we believe in driving this access beyond through ecosystem payers, from hospitals to government to insurers and a lot more, and you'll be seeing more of us doing that as well. Okay, so I'll just breeze through all of this I've covered. Mental health has evolved from an individual to a collective one. Ecosystem players play a role. Measuring for success goes beyond adoption rate, take-up rate, towards value-based outcomes. There's a need to actually measure this through different biomarkers, different indicators, and we believe in driving this a lot more as well. And the third and last trend here is that mental health benefits is for everyone, not just for those who can access it, but those who need it. All right? And let's wrap up in the last 1 minute before we kick off the live segment, the future and what Intellect plans to build for. So we've come a long way at Intellect in building truly the most comprehensive mental health care system that is multi-medium, and we have 3 key things that we want to touch on what's next. So the first key thing of what's next for us is that we want to build truly end-to-end care, right? So you hear us mention this all the time, but beyond devices today, we want to be everywhere. So many of you who have seen this slide, Intellect's full stack system from self-guided care, coaching, clinical, and crisis support. We've expanded this quite a fair bit, and now even beyond the virtual realm, we have in-person care. For those who aren't aware, Intellect actually launched our chain of clinics this year. Intellect now has 2 clinics in Singapore, one in the CBD in Tanjong Pagar, and one we just opened last month in the Heartlands in the Woodleigh area. And we expect to actually open more and more clinics in Singapore and across the region. We believe that mental health care is truly needing to be everywhere, right? The second thing is that we want to go beyond just mental health to really serve the every needs of everybody. So mental health care will always be our core suite and focus, and that will always be our specialty, while we believe also in building holistic well-being care and support that aim to tackle different aspects of our life, be it physical, nutritional, and other aspects of well-being. And you'll be seeing a lot more of that coming up as well. The third thing is measurement. So we believe in actually showcasing ROI for partners, our clients, and individuals itself. So for those that are familiar with this, Intellect actually launched our own Intellect Dimensions earlier this year, which is a proprietary mental health index that aims to measure across 28 different facets of a person's individual well-being and showcase ROI on an individual and a group level that we can share more. And last but not least, we believe in launching tailored specialized programs that goes beyond the general need of the population, but a lot more specific demographics as well. So we've been launching different programs, for example, a maternity program. We're launching programs to support healthcare, different age ranges. And one example that's quite exciting is different forms of access as well. So we've shouted about this quite a fair bit. We have become at Intellect the official mental first aid licensed trainer and provider in Singapore. So we are the only ones that can provide this here in Singapore, and we're happy to do this for the community as well. All right, so